Right to go. There are 20,100 confirmed aggregate cases of coronavirus in Victoria since the beginning of the pandemic. That means there are 15 new cases since yesterday's report. 10 of those are linked to known outbreaks and complex cases, and 5 of those are under further investigation by our public health team. There are a small number of historic corrections that Alan will speak to in just a few moments. There have been, I'm sad to say, now 771 Victorians who've passed away as a result of this global pandemic, 5 since my last report. 1 male in their 70s, 2 females in their 80s, 1 male in their 90s, and 1 female in their 100s. All of these deaths are linked to aged care. Can I, on behalf of all Victorians, extend our deepest sympathies and condolences to those 5 families. There are 75 Victorians in hospital. 8 of those are receiving intensive care and 6 of those 8 are on a ventilator. A total of 2,609,485 test results have been received since the beginning of the year, with an increase of 15,741, so 15,741 results received since yesterday. That's a strong number, and I want to thank everybody who went and got tested the day before. It's a powerful contribution. I know I've said it so many times, but it is the critical point. In order to have a clear picture of how much virus is out there and what the impact of restrictions and therefore the tolerance for easing those is to make the best and most well-informed decisions, we need to have the clearest picture of the virus. If you've got symptoms, however mild, don't delay an hour, certainly don't delay days. Please go and get tested as soon as you register those symptoms. It's critically important. Turnaround time is less than 1 day, and we've got more than 200 test sites right across the state. It is critically important to us getting these rules off and getting to that COVID normal, the most complete picture of how much virus is out there. There are 4,268 cases with an unknown source. That's no change since yesterday's report. There are 73 healthcare workers who are active cases. We wish them well and we thank them and all their colleagues for the quite amazing job they do every single day. We are all very, very grateful for their care and compassion. There are 554 active cases in Victoria, so that number continues to fall. The regional picture is indeed very positive. There are 14 cases in regional local government areas under third step restrictions, so just 14 cases across active cases across regional Victoria. The rolling averages, Metro 29.4, this is as at the 22nd of September, Metro 29.4, regional 1.1. That's very important, obviously, to see that continued stability and indeed further reductions in the case numbers in regional Victoria, given the steps we've taken. Although I would make the point that whole latency issue that we've talked about a lot, the fact that it does take 2 weeks plus for you to get a really complete picture, so it's really important that all regional Victorians, whilst they have different rules to follow, there are still rules, and we would just obviously remind people that they've got to continue to follow those rules. That's how you stay open. It's only when we start to let our guard down in some ways that we can be contributing to the spread of this virus, and that of course compromises everything. In terms of the 14-day average daily case over 14 days falling below 30 for Metro Melbourne, so down to that 29.4, as I think all Victorians and particularly Metropolitan Melbourneians are very well aware, this Sunday marks a next step, provided we are in that band of 30 to 50 cases. So this shows without any doubt that our strategy is working. These numbers are coming down. We are very pleased with these numbers and very grateful for all the hard work and sacrifice and the commitment that every single Victorian is showing. You can't achieve these outcomes, you can't get to that COVID normal without an amazing effort by the vast, vast majority of Victorians, and to each of them I say thank you, and that we are very proud of the work you are doing. In terms of active cases in disability facility settings, there are 4. They are all staff members. In terms of aged care outbreaks and active cases, there are 284 active cases in aged care. I now just want to turn very quickly to some clarifications around regional Victoria and workers who live in Melbourne but need to travel to regional Victoria because of course businesses are now open when they previously were closed at an earlier point. So since we've moved regional Victoria to that third step, there have been some queries raised with us about whether a person who lives in Metropolitan Melbourne can travel to regional Victoria for work. including in working in an industry that is operating in regional Victoria but not operating in metropolitan Melbourne. I can confirm that people can travel to regional Victoria for work more broadly and are not bound by the permitted industries requirements in Melbourne. However, there are some conditions that do remain, and these are very, very important given the different circumstances that regional Victoria and metropolitan Melbourne find themselves in from a virus point of view. The primary rule that if you can work from home, you must work from home remains in place, regardless of whether you're in metropolitan Melbourne or in regional Victoria. A person travelling from metropolitan Melbourne to regional Victoria to work must have a valid work permit. The worker permit scheme allows the employer in regional Victoria to issue a permit to a worker who lives in metropolitan Melbourne. When a person from metropolitan Melbourne is in regional Victoria, the metropolitan Melbourne restrictions apply to them. Even though they're not in metropolitan Melbourne, the rules follow them to their work in regional Victoria. For example, they can't be going out to a restaurant for dinner. They can't be engaging in that activity. They are permitted, they have a permit to go to work and then to return back to their home in metropolitan Melbourne. This in the main, although it won't be exclusive, but in the main, this relates to people that live quite close to the metro regional border and then work on the other side of that border. This was not so much an issue while their place of work was not open, but now that it is open, we think this is a reasonable balance. Of course, can I also make the point to anyone in those circumstances, you can't go to work if you've got symptoms, even the mildest of symptoms, or anybody in your household has got symptoms. The only thing for you to do at that point is to go and get tested and to wait for your test results to come back, which should be within a 24-hour period. There are payments available if you're missing out on work because you are waiting for a test, or if you are missing out on work because you are a positive case and you don't have other entitlements to fall back on. All of that information is readily available, and many, many thousands of Victorians have drawn down on those test payments, the payments waiting for a test, and indeed the broader income support that both in the first instance our government provided, and then we've had the assistance of the Commonwealth for some time since. That principally relates to people who, if they don't work the shift, wouldn't get paid because they don't have sick leave to fall back on. In any event, all of that information, it's consistent with the CHO's orders. They don't need to be changed, but the Q&A documents will be updated to reflect that. So anyone who has any queries is able to go to the website and all of those can be answered pretty much in identical words to the ones I've just used, but any questions, of course, can be answered via the usual sources. I think that's all I needed to do in terms of updates of the day, but I will just finish before I throw to Martin to speak about a very important further funding announcement for alcohol and other drug services and mental health services. I'll just make the point that this is a day when all Victorians can see that this strategy is working. Because of your hard work, because of all the things you're doing and giving up, these numbers are coming down. And as they continue to fall, we will be able to find that COVID normal, because once you get the numbers low, you can keep them low. That's the experience, that's what we're aiming for, and that's what this strategy is fundamentally delivering. And it is a point of pride that Victorians, while staying apart, maintaining that social distance, are sticking together in the fight against this virus. We are winning this battle and we will prevail. It's just a matter of us staying the course, not letting our frustration get the better of us, not allowing our desperate hope and wish that this were over to lull us into a sense of pretending that it is. There's still a ways to go, but we are making very, very significant progress, and it's a credit to every Victorian who's playing a really important part in that. I'll now ask Martin to speak to his announcements, and then Alan can take you through historical corrections, and then we're happy to take any questions you've got.
Thank you, Premier. We know that as part of Victorians' big efforts in staying home, doing the right thing, following the rules, that has seen levels of both mental health challenges and the way in which services who deliver those mental health and alcohol and other drug services have to adapt. And that's been particularly important for our community-based partners in the mental health and alcohol and other drugs field. As part of the roadmap to a careful, cautious and sustainable recovery, we've been meeting with that sector, and based on those round tables, I'm announcing today a $21.3 million package of supports to help those community providers reopen in a safe and sustainable way. That $21.3 million will achieve a range of things that the sector tells us they need to carefully deliver their services in a new COVID normal manner. And that goes to things like making sure that there's funding that keeps workers in a single setting where they have to have face-to-face services, whilst at the same time continuing the trend towards telehealth services wherever they possibly can. That involves extra funding for those services to pay workers more on their hourly and sessional rates to keep people at a single service and to minimise the transfer of employees around different service providers. It also extends the opening hours of services so as to make sure that the demand of people who need those face-to-face services can be spread out over a longer period of time and minimise the chances of numbers of people congregating for those services. It will also deliver a series of minor works programs that will go to everything from, wherever possible, shifting services to an outdoor surrounds, whether it be courtyards, etc., as well as ventilation and creating more open spaces internal to facilities wherever that's possible. These will apply to a whole range of, be it bed-based services, community alcohol and other drug support services, day programs, family and specialist care programs, Aboriginal community controlled organisations, and complement the increasing use of digital health services that we've seen escalate enormously, and I suspect here to stay for a post-COVID normal world. This brings to now over $200 million worth of new mental health and other supports funding since March, when the global pandemic landed in Victoria. This is in response to both increased demand and supporting those services that are at the front line of delivering support to Victorians who are increasingly reaching out for that support. We've seen increased levels of anxiety, of depression, and we've seen people who had previously been in the mental health system, the 1 in 5 of us who in any normal year would seek support for mental illness and wellbeing support, that level increase. And we've also seen people for the first time reach out for support. And I just wanted to focus on one particular organisation, one particular funding stream that has supported 4 organisations in that first engagement that we've seen from people who'd previously had little or no support or engagement with mental health services reach out. In August, we rolled out some funding for the Partners in Recovery program. This is designed through what the industry was telling us needed to happen in response to people reaching out for the first time for support. And I want to thank the NEMI, EACH and AXO as the 3 major providers, together with the Victorian Mental Health Fellowship Support, who have now taken through a mentor system based on telehealth connections, rather than just a one-off engagement, will now stay with you in your journey to recovery. And wherever you are in Victoria, you have the opportunity to ring 1300 375 330 to get in touch with that support service, who will tailor a program of support for your needs and stay with you in mentoring, developing a program for sustaining you through whatever are the challenges that you're facing, linking you up with other support services in your local community, in your local catchment area, to get you on the path to recovery. So that program has just commenced and is already achieving very high levels of demand and support, and is able to bring the benefits of the telehealth world into the delivery of real-world services, and I want to give them a particular shout-out. We know that this has been an extraordinarily tough year for Victorians. Drought, bushfires and global pandemic have come together in a way that has seen demand increase right across the board for our mental health services and supports. Our system for mental health support was already straining and already, frankly, not fit for purpose before the pandemic hit. That is why we've launched Australia's first Royal Commission into our mental health services, and which, having given its interim report late last year, will deliver its final report in February. The Victorian Government has committed to implementing all of the recommendations of that Royal Commission, but we are not waiting for that final report. The over $200 million worth of new investment that has been delivered now fast tracks some of the support that the Royal Commission has said cannot wait: acute beds, support around mental health, community support services and suicide prevention support services. Victorian Government is serious about making sure that the efforts that Victorians have put in to get us through this global pandemic are supported wherever we possibly can, and that includes in our mental health and alcohol and drug services. The message I want to leave people with is there is always support out there. There is always the opportunity to reach out and seek the pathways and connections to recovery for you. Those services, as part of the National Pandemic Mental Health Plan that Victoria, New South Wales and the Commonwealth led back in May, is keeping those services ready and available for when you need them. So I would encourage anyone who's out there who thinks they need support to pick up the phone, get on the internet and contact either Beyond Blue on 1800 512 348, Lifeline on 131114, or Kids Helpline on 1800 55 1800. There is always a better future out there waiting for you. Reach out, get the support you need, and let's get through this, stay the course, and make sure that not only our mental health and alcohol and drug services, but all Victorians are looking to a better future when we come out of this pandemic. Thanks very much. I'll throw to Alan.
Thanks, Minister. Thanks, Premier. There were 15 cases, new cases diagnosed yesterday, but there's been an increase of 24 cases, and these relate to the difference relates to historical corrections. They're made up of 2 patients that were duplicates, and we always get, every time a lab makes a new diagnosis or a new positive test, they tell us, and we go through a process to make sure that they are in fact an old patient that is being tested again rather than a new case that needs follow-up. The 11 cases that were changed to confirmed were taken off the system inadvertently during the process of follow-up, and they were followed up at the time. They date back to July and August mainly, and they were inadvertently taken off the system. So as part of quality checking, we go back to make sure that the record is correct, but they were all followed up at the time correctly. It was only in the process of taking them off from being an active case that they were removed. We're looking at a few other things. So the Hallam cluster is going well so far. There's still close contacts that are under monitoring, but there have been no new cases for now the last 3 days in Casey. There were 834 tests done in Casey yesterday. Throughout Metropolitan Melbourne, the rate of testing over the last 14 days has been fairly constant, so there hasn't been a drop-off in testing, which is encouraging, and obviously I thank everyone who's come forward for testing, for being tested, and to make sure that they don't have the virus. The test rate has been more than 2 per 100 population over the last 14 days. So if we assume that everyone's been only had a single test, that's more than 2% of the population of Melbourne has had a test in the last 14 days. And in areas where we're particularly concerned, where there have been more cases, Brimbank, Casey, Hume and Hobson's Bay and Wyndham, it's quite substantially more than 2%, so pushing into the high 2 to 3%. At the moment, there are 554 active cases and 1,054 close contacts. So just reinforcing that there's still 554 people who are infectious out there. Obviously, we keep in contact with them very carefully to make sure that they don't continue to transmit to anyone else. And then of the close contacts, some of those will become cases, obviously, over the next over the incubation period. But that number is also decreasing, which is encouraging. That probably is all I have, and happy to take questions.
You've got
Aged care.
go on.
So just how many in aged care have you got today?
So there are 284 active cases in aged care and a total of 609 deaths in aged care. I think that's the 5 deaths that were reported yesterday were all in aged care.
And what are today's new cases?
Sorry.
How many of today's new cases are in aged care?
So I understand 4 of the 10 known 10 cases that are linked to outbreaks are from aged care, but obviously there's still others we're investigating.
Which outbreaks are the others linked to?
So they're actually not all one outbreak. So these 4 cases are from different outbreaks and small numbers.
And the other 6, which outbreaks are they linked to?
So one of them, so 2 cases relate to a hospital, and I'm not sure about the others at this stage.
Are the deaths historical, or are they, or did they occur yesterday?
I think 5. So 5 of them were reported yesterday. I think some of them may be before yesterday, but I haven't got that figure, exact figure in front of me.
So since I think we had that day on the 4th of September where there were 53 deaths added to the tally, most of which were historical.
Yep.
I think since that day, I worked out yesterday, every day except the one day when we had 0 deaths, we've had a few historical deaths added to the total. Why is that still happening, and how long ago are those historical deaths?
Most of them are just the day before yesterday, so they're not. They don't go back a long way, and it just relates to the notification process.
So there are no deaths out of these 5 that occurred back in July?
Not that I know of, no.
The 15 cases today, obviously we've had similar numbers earlier in the week, but they were for much lower testing numbers. Do you take greater heart from 15 cases today, given there were so many more tests?
Yeah, look, I certainly do. We normally do see a bit of an increase in numbers on Wednesdays, as people probably know from watching figures daily. So yes, I'm encouraged by that.
And are those local government areas that you just referred to, are they still areas of concern for you? Or?
Look, there still are cases popping up. Brimbank didn't have any cases yesterday, but had 5 cases the day before. So numbers do vary. These are, obviously, when we've been looking at these cases over the last month or so, these are the areas that have been, they have had a higher incidence than other areas. I think I was asked yesterday about where the unknown cases are, and they're pretty much distributed throughout, I think about 18 different LGAs in Melbourne. So most of those are still in the areas where we are concerned. So they've been, I think Casey had 4 unknown cases, unknown source cases, so mystery cases, Brimbank 3, Hume 3, and Hobson's Bay 4. So again, there's just the hint that there's other cases out there, but these cases have been coming down and continue to come down. So I'm encouraged by that.
800, I think 834 tests in Casey. There's 300,000 plus people in that LGA. Is that enough? 800?
Yeah, look, I think we don't necessarily just want more tests. We want people that are symptomatic to come forward for testing. It is about the same as the testing rate is about the same as all the other LGAs, so that's sort of 2 per 100 population over the last 14 days, and that's probably about where we want it. Again, if anyone has symptoms, we want them to come forward. If that's a lot of people, we want more people to come out, but it is in the area that we'd be comfortable that we have good surveillance in that area.
How many close contacts did you say were being monitored out of that Hallam cluster?
I don't have that figure in front of me, but there certainly are a number of households there. In some households, all of them are cases. In some others, they're not. But obviously, we're keeping in touch with them to support them through the period of quarantine or isolation.
Do you know what the ref number is at the moment?
I'm sorry?
The ref number?
The last number I saw was, I think, 0.66 from our internal modelling. That number becomes a little less relevant when we're getting down to these sorts of figures, because it's an average, and chance is who these last cases are is becoming increasingly important. So it's very important that we chase down every last case. But that's certainly encouraging that number is relatively low.
What else has your internal modelling revealed?
I mean, it does suggest that we're sort of on track for Sunday. We're below the 30 at this stage, so I think we're doing better than we had hoped. But we really need to make sure that continues. And as I said, because chance, who these last people are that have infection is a very important determinant of what will happen. We really need to make sure that we're on top of all of that.
So if the current trend continues,
thought that we would be right now?
So it's so I think it was sort of in the sort of I'm just trying to remember now. So it was about 60 something cases at the last weekend, and we were sort of at the lower end of that, and we're tracking sort of at the lower end of that confidence band, but I can't give you the exact figure.
And will you be confident that we would stay under 30 now?
It really goes to this, who these last cases are. So, I think, as I said before, the easiest and the hardest thing about this is this super spreading event phenomenon. So if we keep a lid on all these last cases, then it could actually fall fairly quickly. But one case that happens to be in the wrong place before they become symptomatic, or in a situation where they can spread to a lot of people, and it can be away very quickly. And colac, I think it was spoken about many times. One case resulted in 30 additional cases. They're the sort of situations where we obviously get concerned about, and we're trying to prevent.
So given the current projection, how long do you expect it will be till we get to that under 5 average?
Look, I think we're tracking well at the moment, but things can change very quickly. I think it's hard to predict the future, but at the moment things are encouraging that we might get there a little earlier, but we really need to see over the next week or so.
Just on the super spreading event, obviously international experience says 20% of cases contribute to 80% of infections. Has that been true for the second wave here in Victoria? Have 20% of COVID cases contributed to 80% of the spread?
I can't give you the exact figure, but it is around that sort of, and that's generally what you expect, because it's behaving the same way in a lot of in most countries, and that really reinforces that these are those sort of settings where the spread can happen very quickly, where there's a lot of contact between people, are the settings where we worry the most about.
Premier, looking to Sunday, will the next step happen on Sunday or on Monday?
I do have a couple more questions for Alan. Is that okay? Just very quickly, sorry.
Yeah, no.
Just on the LGAs, I think you mentioned that we've got that those 41 are spread across 18 LGAs. How much of an obstacle and how concerning is that we've got all those mystery cases spread across Melbourne?
Look, I mean, each LGA has a relatively small number of cases, and I guess it does reflect that there has been community transmission out there. We're doing our best, I think, in all of those to make sure that, to try and track upstream to see where they've got it from. So we often do testing of, everyone who they've come into contact with over the last 14 days, as opposed to the downstream contact tracing. But I think we just need to keep an eye on that number, and if no further cases pop up, then we would be relatively confident that there's no further transmission.
Just on aged care, I think we had 24 of yesterday's 28 cases were linked to 11 different clusters in aged care. How worried are you about that, and how much of an obstacle is it to have so many cases still linked to aged care?
Yeah, aged care is always a very important setting, and both from the risk of spread, but also the consequences for our residents there. There's been a lot of work to try and make sure that we're coordinating with the Commonwealth to make sure that all those things are in place to stop further spread. But just reinforcing, a single case is an outbreak in an aged care, so we treat it as an outbreak. But even if there's no transmission to other people, but it is such an important setting, and we really need to make sure that anyone who, they have all their COVID safe plans, they have a good response, and anyone who's unwell or that works in an aged care doesn't go to work and gets tested.
A lot of those 11 yesterday were linked to clusters that are in the hundreds that have been going for weeks, though.
Yep.
Are you concerned that those have taken this long to shut down?
Yeah, certainly. I think that even after there's transmission exposure stops, there is the tail because, but certainly when they go on for long periods of time, that's when we certainly do get concerned.
And how many aged care residents are still in hospitals, and when are they starting to move back to their own homes?
So I haven't got a number for you, but certainly as residents recover and when they're no longer infectious and it's safe for them to go back, and the receiving facility is they're ready to take them, then it's time for them to go home, and that's appropriate. But there's certainly a lot of discussion between the health service and the aged care facility to make sure that that they don't all go at the same time, and that they have the capacity to take their residents going home.
And so, is that happening already, or is it about to start?
It is happening, and so as outbreaks finish, then they get moved slowly back to their homes, and it's sort of a continuous process that's been happening over some time now.
Just a question regarding taking the next step. Is that to happen on Sunday, Monday or Tuesday? There was a bit of confusion around when that actual...
At this stage I'll be making announcements on Sunday. That's certainly my intention, provided they'd come into effect sometime thereafter, whether it's midnight Sunday or midnight Monday. We'll work that through. That'll be in some respects determined by the nature of the announcements we make. The band we're chasing is 30 to 50, and right now we are in that. We are in fact better than that, at just under 30. The key point here is that we've still got a few days to go, and we've just got to refine things and make sure that we're confident that the numbers we're getting are an accurate reflection of how much virus is out there. But these numbers are good. These numbers are a very positive trend. The trend is with us. The strategy is working, and that's why it's so important that we stay the course and move through each of these safe and steady steps, and not rush to do too much too soon. Otherwise, all our hard work, the hard work of Victorians, won't count for much.
Just on the roadmap though, you forecast very limited steps come
Yes.
Sunday. So given the numbers and what Alan said about we're doing a bit better than you might have expected, are you looking at going a bit further than what you'd outlined a few weeks ago?
Yes, I am, but I'm not in a position to give you a full list of the things we're looking at. We're having a look at those, and they become a really detailed and fine judgment about what the public health risk, what the virus transmission risk is. We only want to do those things that are safe, and we don't want to do something that might seem quite small but could present a significant challenge to us in a couple of weeks' time. That's part of the nature of this virus. That, and I know I've made the point many times, but it's worth repeating again, that what we do on Sunday, the full effect of that won't necessarily be apparent to us for a couple of weeks after then. So that's why they have to be cautious steps, steady steps, and of course all the steps we take have to be safe.
Could you give us an idea of in what areas those...
Would it be they're along the same, yeah, exactly. They're along the same lines. Again, I'm answer the question honestly, but equally, frankly, I can't give you a list of all the things we're looking at because a lot of those are nowhere near settled. It's all about modelling. It's all about a really deep analysis of the actual data we've had over these last couple of weeks, and then trying to extrapolate about what that tells us the next couple of weeks might look like and the couple of weeks after that. I know it's frustrating. I know everyone wants answers to these questions. I am among those who want answers to all these questions. But what I know, what I think is really beyond doubt, is that we've got to do this in a very gradual, safe and steady way. Otherwise we finish up, run the very real risk of just giving back everything that we've been able to build. But the strategy's working. The numbers are coming down. The trend is positive, and that's a credit to everybody who's helped to deliver this outcome.
Police
police told members of the community not to search for the missing autistic boy William Wall last night. He's 14 and he's missing in bushland because of the 9 p.m. curfew. Do you really think that's acceptable?
I'm not sure what advice Victoria Police gave. That's not a matter that I would have been, well, not involved in that, but I'm more than happy to refer your question to Victoria Police. I'm sure they'll be able to speak to
Even
that.
if they didn't give that advice though, do you think that the curfew's driven so much fear into Victorians that they won't be searching for a missing boy out of fear that they'd get fined because of the curfew?
No, I don't believe that's the case at all. But as to, just to go back, you've asked me about something that you say Victoria Police said. I'm telling you, go to speak to them. That's the most important thing to do. They are the ones who confirm what, if any, advice they gave. On the second broader point that you've just made, I don't accept that logic. There's a big team of SES volunteers, Victoria Police. There'll be other people out there helping with that effort. I thank each of them for the amazing work they're doing, and I hope that William Wall is found as soon as possible. We send our best wishes to his family. This will be a really difficult time for them. But as to what was or wasn't communicated from a member of Victoria Police are the best people to try and clarify that for you.
Just to clarify, in your view, should an exception be made for members of the public who might be out after curfew looking for that?
My understanding was that there may have been some decisions made in relation to COVID safety, for instance. But again, I'm only speculating. That's what I was briefed this morning as to exactly what's occurred there. Police are the ones to be able to answer that question.
What do you mean by COVID safety?
Well, I suppose it's very difficult to congregate in large groups at the moment. So there are a whole range of rules, and they're not to prevent anything other than the spread of the virus. But I've got no advice that says that the rules have impeded the amazing work that's being done as we speak, and hopefully they can find him very, very soon.
All the volunteers who turned up this morning have been told to go home and instead spread the word on social media. If they're searching through bushland, maintaining social distance, what could be the
Again,
issue?
I'm not the one that's told them to do that, Candice. The only people who can speak to that are the people who have apparently said that, and I'm more than happy to facilitate a Victoria Police spokesperson answering those questions.
So can you send them a message through the media right now that that's not a good idea?
It's not my practice to communicate with the Chief Commissioner via the media, with the greatest of respect, as important as your role is. That has never been my practice, nor will it be.
Sorry, will you call him then? Probably a better phrase question.
No, I'll make sure that my office contacts the Chief Commissioner's office, not the Chief Commissioner, but the Chief Commissioner's office and police media, and makes it clear that there are some questions that have been asked. I'm not in a position to answer them, but they need answering. And I'm very confident that the Chief Commissioner and his team will provide you with the answers that you're after.
Should those people have been turned away if all they were doing was going through the bush looking for this boy?
Again, with respect, I don't know that that's occurred. I know there's some social media reports. The best thing to do is to have the people who have apparently made that choice explain to you whether they have done it, and if they have done it, for what reasons.
Surely this is an example, though, that this curfew has driven so much fear into Victorians that they wouldn't risk breaking the curfew.
No, I think you've asked that question already, and I've rejected the
emergency.
premise of that question. That is not accurate in my judgment. The curfew has served to help bring these numbers down. That's what the curfew has done. And I do not accept it's not really a question. I think you're putting a statement to me. You've done it twice now, and I don't accept it.
Just on the point of the curfew, the Supreme Court has given the government until 2 p.m. today to decide, I guess, whether it would claim public interest immunity to conceal files relating to the extension of the curfew. What will the Victorian government... Will you guys be, I guess, claiming public interest immunity?
I can't give you an answer to that because I have no knowledge of what the status of that is. What I can say, though, is that it's obviously before the court, as your question indicates. So I'm very limited in what I can say.
Will you be claiming public interest immunity?
I
What's the government's position?
The absolutely frank answer to you is I do not know, nor am I acquainted with what documents the court has sought or parties to that action have sought. And that, I think, speaks to the fact that I'm in no way involved in that matter. That is a matter that is being dealt with by appropriate legal teams and others who are called in that action. So that's not a matter that is on my desk.
Just in principle, is there any reason why documents detailing why you've made the decision to impose a curfew on Victoria that affect all Victorians at the moment should those documents not be made public?
Rules, practice around public interest immunity, cabinet in confidence, whole range of different things are well known and well understood, but it is incredibly difficult to make broad statements unless you know and understand the context and the nature of the documents being sought. I have no such knowledge, and I'm in no position to be able to even provide a broad commentary on that. As I said, these matters are before the court, and it's appropriate that they work through that process. And they may have views on whatever claims are or aren't made. So that's the reason why I really can't engage in that. Nor do I have the knowledge. It's not something that I'm dealing with. It is not on my desk.
You're in for the hotel quarantine inquiry on Friday.
Yes.
How many lawyers will be there representing you?
No idea. I have legal counsel, as all ministers do, as all public servants do, as is custom and practice for many, many decades.
Privately hired or?
No, they are employed pursuant to my role as the leader of the state, just as they have always been for many, many decades. There is no change whatsoever to the arrangements that are in place.
Can we just seeking some clarity on a couple of rules? Is outdoor
Sure,
basketball,
I'll do my best.
Yeah, outdoor basketball court, shooting hoops, is that allowed at the moment?
Well, look, rather than me doing one at a time, I think the best thing to do is get detailed public advice. We've been down this road before.
Yep.
We have, and the last thing I want to do is give you an answer that might accord with my interpretation, and then the Chief Health Officer perhaps has a different view, or vice versa. If you've got any specific settings that you want me to chase up, I'll absolutely do that for you.
And just with when next week, I think you said landscape gardeners, outdoor maintenance is allowed. Are they allowed to work in teams of 2, or will it just be sole operators?
I'd need to double check so that I'm giving you the absolutely accurate answer. I know they're coming back as a sector, but I'm not entirely sure what the arrangements, and there'll be COVID safe plans and various things that we would want them to do. So why don't I get you that detail as well as the specific answer to 1s or 2s.
Do you think, theoretically, I think there's some concern that they'll have to work on their own, but given a lot of them are working on big properties outdoors, they might need assistance holding ladders. Do you think it's appropriate they could work safely outdoors with 2 people?
Well, let's firstly work out what the actual rule says and what the proposal at this stage is, and then we can potentially have a process to work through any concerns that sector has raised. That's what we've done all the way through. So it's whether it's those sorts of activities or very large workplaces with many hundreds of people, we've been in a constant discussion and conversation about planning, trying to be as reflective of the practical realities in those workplaces. The notion of 2 up for safety and things of that nature is well known. Let me get an answer to your first question, and then if there's a need to put that into some sort of a process with the Chief Health Officer, then that'll be one of many different issues that he and his team are working through.
With a couple of issues with regions, given 14 active cases there, is the government giving any consideration to easing indoor capacity restrictions for hospitality venues? Apparently quite a few have been rained out and they're turning customers away because they can only get 20 of them.
Yeah, indeed. It'll be, weather is always challenging. That's why there are grants there to not just put up, or to try and support the most robust outside structures that still meet the rules in terms of airflow and are still actually outdoors. It's not about building structures that are essentially indoors. Look, we're looking at all of the different options that are available to us based on those principles I mentioned before, Lundy. Safety and the fact that whilst this weekend will mark 2 weeks, the middle of the following week will mark 2 weeks, if I've got my dates right. That's when we'll start, so it'll be Wednesday. A week from today will be essentially 2 weeks since that third step was taken in regional Victoria. And we're very closely monitoring what the virus is doing, testing, all of those sorts of things. As soon as we can take further steps that are safe, then of course we'll do that. And that's not just in regional Victoria, that's what's guiding us in Metropolitan Melbourne as well. But you do get to this point where the numbers could tell you that it's safe to go faster than we had planned and had made clear in that roadmap, but not enough time has passed for you to have that underlying confidence that we're not missing something. And that's that passage of time issue that I've talked about a few times. And of course, it just goes back to that central point. The facts are, logic tells you, not everybody who's got symptoms gets tested, so there will be more virus out there than the case numbers that I report every day. But the question is, are they a good proxy for what's out there? At this stage, we believe they are, but we'd always reserve the right to allow some further days to pass before we made any decisions, because once the decision's made, as to the question before about super spreaders, one person, and the issue of chance. So one person who happened to find themselves and spend time in some unfortunate locations where they were mingling and mixing with quite a lot of people, otherwise known as the place being open, that's when you can have not 1 to 30, but 5 or 6 become 300 or 400. So that's the really challenging part about it. So within all of that, we look each day at the data and we'll take whatever steps we can when we can do that safely. And Sunday we'll be able to account for some of those, and then that's a continuous process.
Just another one for the regions. Is there any extra support on offer to schools and camps to get those camps happening in term 4, given I guess they haven't had a heap of time to prepare and school camps do take a little bit of...
I understood that part of the Deputy Premier's announcement the other day was some additional support for that sector, but I can follow that up for you and get the exact nature of what that is. And if there's I wouldn't want a situation where it's COVID safe to go back to camp, but there are some financial issues that prevent that. I wouldn't want that to happen, and I wouldn't allow that to happen. So let me double check what's in the package that James announced the other day, and if we need to go further, then of course we would.
Just staying on the theme of regional Victoria, a few days I asked you whether or not you had spoken to Gladys Berejiklian about opening the borders. You said you hadn't because you knew what the answer was. On the same day, she said we'd be open to, opening our borders to regional Victoria, easing those restrictions, but not to Melbourneites. Have you since spoken to her about easing those border restrictions?
No, but I think our officers have spoken. I haven't spoken to her, but I'll speak with her at the appropriate time. We talk when we need to, and when we do, it's always a cordial and particularly productive discussion. But
what was their discussion between the officers?
I'm not sure. They speak about all sorts of different things, but that is good news. The most important thing I can do is probably not be on the phone to other premiers, but just work as hard as we can to get these numbers down. That's how we'll get the borders open, by getting these numbers down even further than they are. And I'm sure that Gladys and Stephen and Peter and all manner of other people will be looking at these numbers today, and they'll see the trend, and they will see that this strategy is working, and that we are being successful, all of us as proud Victorians, in getting these numbers down, finding that COVID normal. And part of that will be the notion of being able to travel much more freely within the state, and indeed to travel beyond it.
A large number of very senior lawyers have raised fundamental concerns with the Omnibus bill, calling it unprecedented excessive powers and unconstrained powers to detain people before they've essentially done anything wrong. What assurances can you give the Victorian public that these powers won't be abused, that people won't be locked up before they've done anything, or will you consider perhaps tweaking some of these rules?
Well, we'll have a good faith negotiation process with the crossbench, as we do on all issues, and we saw the results of that when we last went to the Parliament with a COVID-related matter. Those discussions continue. I don't have an update today on where they're at, but our normal practice is to engage meaningfully in a good faith way. And I've always resisted the temptation of predicting what happens in the upper house, and I shan't change that habit today. In terms of the concerns that are raised, people are free to raise concerns. I would say that there's a structure, there's a formality to this, whether it be extending and reclassifying a WorkSafe inspector as an authorised officer, reclassifying a member of Victoria Police as an authorised officer, reclassifying a PSO as an authorised officer. All of those people work within frameworks, they work with oversight, they work to a rule book. We can agree, I think, on the first of the three criticisms. It is unprecedented because we're in unprecedented times. And if you want workplaces inspected to make sure that people are doing the right thing, if you want all the different compliance work that we do to be as effective as possible to keep us open, then you have to have a bigger team. And you also have to make sure that rather than a workplace being inspected by, for instance, because the legal structures have different powers and responsibilities sitting with different people, there's got to be someone from police, someone from WorkSafe, somebody from the health department. That doesn't make any sense. If you can try and combine that and essentially double, triple the resource available to you, then it just stands to reason that we'll finish up with more people doing the right thing. And that's the thing that shouldn't be missed in this. There are many industries who've worked extremely hard to get to be as safe as they possibly can. And I think today they're more COVID safe than they've ever been. And that's why all of a sudden a range of options become open to us. To take supermarket distribution centres from supermarkets, probably actually more broadly, from in the 60s, so 60%, 65%, up to a much higher number, looking at abattoirs, looking at all manner of different settings.
Why does the Omnibus bill, though, need to give people the powers to detain people before they've even done anything wrong, just on the likelihood of...
Well, they are based on a reasonable belief principle, and they're based on a proportionality principle about the risk of spreading COVID. And there are some people who are not compliant, refuse to act in a responsible and safe way, those powers would not be frequently used. They would be, I think, rare, but they are important. The tolerance and the...
have your word for that. No, I'm not
Yeah, but again,
questioning
there...
your word,
No,
but your
no,
intention
of course,
is often interpreted differently on the
Of course you are,
ground.
Laurel, and I'm very grateful for that. The key point here, though, is that there are structures, there are oversights, there are accountabilities. There's a formality to this. And, again, the debate can be had on the floor of the Parliament. We'll brief and discuss and talk through all those issues in good faith. We wouldn't be taking these steps if we didn't believe that they were proportionate to the challenge we face. And it is correct to say that we are in unprecedented times. And nobody's particularly pleased about that. But once you get to the point where, as Alan made the point before, where chance becomes such an important part of it, you know, a very small number of people doing the wrong thing can have implications for everybody.
So
In
has
fact,
police
would
asked
have
for these
implications for
powers?
everybody. Pardon?
Have police been the ones who suggested these changes?
There's been a long discussion over quite some time about the number of authorised officers we have, the fact that different powers sit with different people, and some improvements to that whole compliance arrangement. As to detailed correspondence and all of that, I'd need to come back to you on that, but that's been an ongoing discussion that I know that the Department of Justice and Community Safety and all of their stakeholders have been an important part of that.
A bit like curfew and hotel quarantine, though.
Well, that is exactly why I'm indicating to you that I'll come back to you, so as we don't all get into these word games of long discussion about the need to make these improvements. Many have been involved in that, but on the specifics, I'll come back to you.
Have there been situations in the pandemic so far where having these rules would have changed the outcome?
I'm not sure. We've certainly had some examples of people, because again, it's not a matter of that it'd always be a very fine judgment about whether these powers were used. That's the key point here. These are not blanket decisions. And the fact that people have the power to do something and the authority and the clarity to do something doesn't presuppose that they will. They'll always, and they'll be required, to make very detailed, personal, on the merits, if you like, of the individual circumstances and the case, those very fine judgments. And that in itself is a very important part of any process. These are not blanket rules. But we certainly have seen some people who have had the virus and been unwilling to follow the rules. We've had lots of different examples. I wouldn't say it was hundreds or thousands of people, but it doesn't need to be. It doesn't need to be. But these would not be powers that would be exercised easily or lightly. They would be the subject of a chain of command, a structure, authority, oversight, and a very detailed and thorough analysis of the risk that that person posed and the likelihood that they would that risk would be real because of the choices that they would make.
Can we ask the Minister for Mental Health, just because I know these rules in part target people with perhaps mental health conditions?
Well, what I wouldn't want to do, Lundy, is to be targeting anybody, and we have to be very careful with that, but there are some, it's simply a fact. It's not a judgment, it's not a commentary. It is a fact that for some people, they will find it easier to be compliant with the rules than others. There will be some people who, for many different reasons, have a greater awareness of the risk that they and their conduct might pose. That is in no way a value judgment against any individual or any class of person, and we've got to be very careful. I'm not alleging you aren't.
Perhaps the wrong word.
I'm not alleging that you aren't, because that is not my experience of you or your network. But we all just need to be careful about stigma and things of that nature. But it's just a fact, and it's not, I think, helpful maybe to go through a list. But there are some in the community who will find it harder to act in accordance with the rules for lots of different reasons. We have many complex people or people with complex needs. And on that basis, we always provide care and support to them in the most holistic way. The notion of involuntary treatment, for instance, is a well-established principle of Victorian law and well-established principle, particularly of our Mental Health Act. None of those decisions are ever made lightly, ever. And there is absolute oversight as to all of those matters. If Martin can add to those comments, I'm sure he will.
Yeah, so I guess my question would be, how would these rules be applied in a way that perhaps they haven't been in the past 6 months? What would be different?
So we know that the powers to compulsorily detain someone for mental health treatment are a very high bar, and necessarily so. But we also know that a very small number of people with highly complex needs sometimes expose themselves in all sorts of vulnerable circumstances. And we know from the experience of the past 6 months that sometimes those people can be challenging in how they engage with the rest of the community. And the kind of powers short of compulsory detention for mental health support, but for public health support, are precisely the measured, reasonable circumstances that the Omnibus Bill contemplates. We know that you have to deal with the reality that this is a wildly infectious virus, and that a very, very small number of people who may be exposed to it in limited circumstances sometimes need, short of compulsory detention for mental health issues, but for the public health well-being of both themselves and the wider community, that is precisely the kind of circumstances that are envisaged through the Omnibus Bill.
Premier, can I just ask you a question
Sure.
on the compulsory detention side of things?
Sorry, Samara, I didn't hear the last bit of that.
I'll ask the question.
Oh,
right
sorry,
now.
sorry.
Yep. Obviously, the public housing towers in North Melbourne and Flemington were locked down, and people were, involuntarily detained in their homes for a number of days to contain the spread
Correct.
of COVID. What powers were used then, and why can't you continue to use those powers into the future? And you need this extra power of what the Omnibus Bill is proposing.
Well, I think it's important to look at those two examples. So, for instance, I think it's very difficult to draw broader examples because we are the landlord, and Victoria Police essentially secured that site. The notion of anybody wandering off, as it were, and potentially spreading the virus was not a material consideration because they were literally locked down and no one was allowed to go in or out, from a resident point of view, I mean, unless we had approved that. So if somebody had to go to another setting in order to isolate away from their family, we of course made that happen. So I don't know that the example is actually useful because that site was absolutely secured. So the whole issue of people being non-compliant with the Chief Health Officer's orders wasn't really a feature of that, because we had literally surrounded the place and we had it locked down and people couldn't leave. And as in your question, that did contain the spread of the virus, and whilst there were some positives there and there was some very limited but some tragedy there as well, it was nothing compared to what it would have been.
Premier, seeing as we're ahead of schedule in terms of our 14-day average, it's now below 30.
Yes.
Will you consider lifting the curfew before the end of October?
I have no announcements to make about the curfew. The curfew provides police with a very easily enforceable rule. It means less people going and visiting friends, and accordingly it'll be in place for as long as it needs to be in place to get these numbers down and keep them down. It won't be there forever. It's there whilst ever it serves a really useful purpose, and that is to make sure that people are not out and about, and where it gets into this situation where Victoria Police have got to sit there and have interminable, lengthy discussions with people, having all sorts of manifestly incorrect, false statements about where they were going. You've either got a reason to be out or you don't, and the curfew just makes that much easier to enforce. It doesn't change the reasons for which you can leave your home, though. I think I've gone to this point at some length. The curfew does not change the reasons for which you can leave your home, and to the best of my analysis, the two things you might be unable to do is to go and exercise in the middle of the night, or to go shopping in the middle of the night. And I apologise for any inconvenience that causes, but the benefit far outweighs that.
There's no health risk though if someone wanted to exercise in the middle of the night, right?
Well, that is not allowed. So that question doesn't really need answering.
Seeing as there's less community transmission as there was at the height of the second wave, when will you look at making masks an advice level rather than fining people for not wearing them?
I've been very clear on this. Masks are very important, and we won't be lightly changing those settings. It's a small impost, again, not necessarily the most pleasant experience, but in terms of the benefit that it gives you, If I might make just one example, you know, you look at Sydney, they're currently chasing all manner of passengers from one taxi driver. Masks are very important, and that example gives you one example of that. That case gives you one example of that. But again, we won't be lightly changing those rules. They're very important, and despite some of the absolute nonsense, and that's all it is, about encroaching on people's civil liberties and human rights, wearing a mask is not too much to ask Victorians to do, and I'm so proud that they are. The nurse treating you in ICU will be wearing a mask, and it's not too much for you to do the same to not contribute to more people in hospital.
With regard to the decisions to take the next step, who will be making those decisions? Is it you, the CCC, or is it the health officers or
There'll be
state
advice.
controllers? Who's making that decision?
The basic process is this: the public health team and others that they may seek expert advice from, together with where it's logistically important, some other departments can be engaged as well in providing advice about how a rule would work in a given workplace, for instance. That advice comes to the CCC. The CCC makes a decision. Cabinet will be engaged as well to be briefed on that decision as well, and to provide any input. They provide input along the way also, where it's relevant to their portfolios, and then the decision will be announced.
Quality and, I guess, accuracy assurances will you be seeking for rapid testing to be used to open up aged care facilities to visitors, if any?
So when you say rapid testing, Sumaya, do you mean like a blitz or a different tech?
No, just different technology, like 15, 20-minute tests.
Oh, right. So we currently have some further work being done to validate, triple validate the saliva test. And there's an enormous amount of work going on at the moment with not just one, but with multiple rapid point of care tests. So the notion of a finger prick, for instance, you know, a bit like a blood glucose level test. And once that's proven, once we've got the experts telling us that that's just as reliable as the swab test that we do now, then that's going to be, I think, a very significant change. The notion of subject to supply, of course, being able to test people and have an outcome within 30 minutes, say, that fundamentally changes everything.
So the results of the rapid testing would need to be like for, I forgot the name of the other test down the
It'd need to be certainly within a tolerance. It would need to be very close to just as accurate.
Is it like
I wouldn't
points?
make those judgments. Others who...
Alan Cheng, would Professor Cheng...
Alan might, but Alan would be speculating on something that's ongoing. So we'd have to wait and get the results first before we're going to make a judgment like that. Look, you would never deploy a testing technology that you weren't as confident as you could be was a good proxy for how much disease is out there and an accurate reflection of how much disease is out there, particularly in a setting like aged care. However, the same argument could be run well. If you do asymptomatic testing in aged care and you only find, 1 in 50,000 or something, is that how worthwhile is that? Sometimes you do things not as a single layer, but there might be multiple things that you do, and when you combine them all, there is no tolerance at all. You've got something that is an absolutely definitive picture at a point in time. So I wouldn't look at any one technology or one practice. I think it's a series of things and it's a gradual approach. So visitors, gloves, gowns, masks, testing, deep cleaning, all temperature checks, all of those things.
And the 2 suburban contact tracing hubs that you didn't announce yesterday, are you any closer to rolling them out?
I'll have more to say about those at the appropriate time.
Will they be in Brimbank and Hume?
No, so what we've done is, yesterday I announced Monash, so that's the southeast, Austin, which is kind of that inner northeast. There may be one further out into the north, but that's not determined yet. And Western Health was the other one that I spoke about yesterday, so that's the west covered. We had indicated there'd be an eastern presence, so probably out that Eastern Health catchment, but those last 2, we'll have more to say about that quite soon.
Just given that Brimbank and Hume have been pretty hot areas.
Well, Western Health obviously.
In that zone. But
Western Health has some
dedicated
coverage
teams.
of that. Western Health has some coverage of that, and we'll have more to say, particularly about the north, soon.
It seems very obvious that for the north, Northern Health would take over the contact tracing will be the lead health service for contact tracing, and in the east, Eastern Health. So I guess what's taking this long?
Well, I wouldn't describe it as taking over the contact tracing.
No,
It's about supporting at a local level the public health response from the centre. It's not just about taking all of those who would have ordinarily done that work and putting them out in the local area. It's about both. So it's about bringing local knowledge to that task, and to a certain extent, every single hospital across Metropolitan Melbourne is involved in this because they've had the lead on contact tracing their own staff, and we know how many staff have been positive cases or indeed close contacts. It's nothing more or less than the final details need to be stood up, and I'm not going to announce something that isn't ready, and I'm not going to announce something that gives you, rightly, the impression that they're doing work that they aren't yet doing in that formal sense. But it'll be quite soon.
On the Omnibus bill, are you concerned it might not go through the upper house? And if that happens, what happens to all the measures that you're just purely seeking to extend from the original bill, the sort of normal measures?
Well, what I'd say is that there was a lot of speculation about what would happen with the last bill that we put through, and ultimately we got an outcome. I think this will be no different. Whether it's identical to the bill that gets presented, that's entirely a matter for my colleagues in the Legislative Council.
But as to those measures, like the local council measures and the court measures, when are they due to run out?
Well, you make a powerful point that there are some things there that couldn't be allowed to run out really, otherwise there'd be really significant consequences. And I think just as you've come to that conclusion, I would hope through good faith discussions that a majority of legislative councillors would come to the same view.
Couldn't you?
They may. The reason I hesitate to give you a date is that they might be different. I'm not sure whether they all sunset on the same day. I know that all the provisions are extending sunset in April next year, but I'm more than happy to chase that up for you.
Couldn't you aid that process by separating the controversial bits from the uncontroversial ones?
Well, no, I think it's perfectly possible for the Legislative Council to work through a bill line by line. They do it every week they sit, and that's what they did last time. That's what they'll do with this, and we'll see what comes at the end of that. Just as we did last time. It's as I said, I don't predict outcomes in the upper house, but I can certainly predict that our negotiation and our conversations will be in good faith, and I'm always grateful to crossbenchers who engage in that. That's the way the Parliament should work.
Is there a reason Professor Sutton hasn't been here this week?
He's having some time off.
Can I ask Minister Foley a couple of questions on
You
mental
certainly
health?
can.
Hi, I think when you were here early last month, you said that there had been an increase in mental, I guess, in people admitting to hospital for mental health issues.
Yes.
Have you been able to determine, I guess, what the mental health impacts of stage 4 has been on Victorians?
Well, we're still in stage 4, and the reports come through when they come through. But I think I've reported a couple of times now. I think we saw at the early parts of stage 4 through the whole pandemic a significant spike, particularly in presentations in emergency departments. I don't have the figures with me, but when we last reported, for instance, I think we'd seen a 33% increase in young people in particular presenting at emergency departments. Since then, that figure has come down to 26%, and some other more positive directions of support coming through had seen the number of presentations coming down. Having said all of that, we are no different to other states, and we are no different to other jurisdictions around the globe in terms of seeing heightened levels of both acute and community presentations in mental health settings, because this is a very stressful time in which communities right across the globe and right across Melbourne and Victoria are facing some really significant challenges. And that's why we've invested over $200 million worth of programs, new programs, to both deal with that demand and to change the processes of how we respond to that demand. And I'd like to think that on the measure, the most awful measure that's reflected in, and that is suicide and people dying, that so far we continue to be ahead of that that awful demand, that awful curve, but we know that trauma expresses itself not immediately, but cumulatively, and coming off droughts, coming off bushfires, coming off a global pandemic, we would expect to see in 6 months, in 12 months' time, the peaks in demand for these services, which is why we're investing now, which is why we look forward to the Royal Commission giving us a pathway to establishing not just Australia's best, but the world's best mental health support system.
When you provided the figure that presentations to hospitals had increased by 33%, it
For
was
young
over
people
a certain
under
period.
18, I think it was, yes.
Can you, it's come down to 26%, as you've said. What dates, or as in what periods?
So these are
do you know?
6-week rolling figures compared to the previous year's figures. So they're taken periodically, and the services measure demand in the previous 6 weeks and counter that against the same period for the 12 months preceding.
So what was the period for the 26%?
You've caught me on the hop, but
Sorry through it all, but we can get it.
but we can get it for you. It was clearly during the pandemic.
August.
Yeah, it was early August, but we'll get the exact dates for you.
Any other issues? You sure? Very good. Thank you. We'll see you tomorrow.